Hey guys, welcome to the third episode of the Brain, Body, Mind podcast. I'm Dr. Brad DeBeer.
I'm Dr. Hannah Wadsworth. We are co-founders and co-owners of Axon Integrative Health out here in Denver, Colorado. And our purpose on this podcast is to deliver high-quality health information and basic lifestyle guidelines at zero to no cost for anyone and everyone to be able to utilize to some degree. Our mission here is to change the paradigm of healthcare. That's just our mission in life in general. So our topic today is concussions, and we're going to be talking about the different types of concussions. We're going to be talking about the metabolic cascade that goes along with concussions and how you can have some longer term issues following concussion that doesn't seem related, but it definitely can be. We'll also go over who to look for, what to do as far as treatments go, and things like that, stuff you can do at home. That way you can get on the right track with treating your concussion.
Yeah, I just feel like there's a lot of misinformation out there in the concussion realm, and it's definitely becoming more and more of a specialized field, and there are tons of providers doing great things all over the place, and finding one that does good work really isn't that hard anymore. You have to know what to look for. So I'm going to help cover all those and give you some tips for at home to use, and if you're not having to deal with concussions for extended periods of time, you can get back out to what you do, what you love doing, and no sense in suffering and dealing with long-term issues like sleep or anxiety or brain fog or fatigue or anything like that. Stick around and find out some tools.
So to get started, let's go ahead and tell them what a concussion is, a little bit of the basics just around concussions in general.
Concussion is double injury here, and initially everybody thinks of the physical aspects of a concussion and this brain kind of bouncing around within the skull. There's a small degree of shifting and movement in there, but in that creation of axonal damage does lead to structural abnormalities in the brain, things like that. But the biggest thing is it is a metabolic injury as well. It is a chemical irritation in the brain, and this offset of nutrients plays a much larger role in this symptomatology of concussions way further than the structural damage itself. When you get into larger grade TBIs and diffuse axonal injuries, that's where we're looking at full structural changes and shearing of axons within the brain that create a whole host of other issues. But in concussions, this is much more of a metabolic injury. And this neurometabolic cascade of events that happens is this sudden flood of calcium and glutamate into the cell, and this decrease in blood flow and cerebral blood flow, which reduces glucose, but in turn also the brain is demanding more glucose at that time too. There's a whole host of these chemical changes that go on that last up to 72 hours, and if left unaddressed or untreated, can cause alterations and changes in glutamate and GABA balances and calcium and magnesium balances within the brain, and ultimately just long-term inflammation and dysregulation.
Wow. So then what would you say for people right after they get a concussion? What's the best thing to do as far as like first steps of you just got a concussion? What are you wanting to do for the first 72 hours?
So some of the best things is immediately when you get this concussion, try to remove yourself from, if it is a sport, or get back to a safe spot as easily but quickly and safely as possible. So if you're on a football field or on a soccer pitch or a hockey rink and you have sustained a concussion, got hit, or if you're a fighter, MMA fighter, and you get knocked out, or you take a pop to the head and you feel like you got your bell rung, the first kind of sign, I guess, is head shake. And if you feel like you just stood up and you got to shake your head and orient yourself again, that has, I believe, a 72% likelihood of concussion if you have done that maneuver, which is pretty incredible. It honestly makes it one of the most efficient tools determining if an athlete has had a concussion. But if you're out in the woods, you're out doing mountain sports, try to take some rest, get back to your vehicle as safely as possible. Try to monitor for some signs of issues. If vomiting or your pupils start changing sizes or things like that, a headache that worsens, definitely take some ER visit and make sure that everything's okay, because we can develop a brain bleed or subdermal hematoma, something along those lines that are way more scary than just a simple concussion. So make sure that you don't just try to bear through it. And if you do notice some of these signs, seek help right away. But outside of that, if you're able to rest and be able to do some breathing, make sure you get some good fluids and hydration and electrolyte balances in, because again, you're having a big shift of calcium and magnesium in and out of the cell. Making sure that you help stabilize that by getting a dietary intake of some of those nutrients is extremely valuable. Things like rest in a dark room aren't really a thing anymore, at least for multiple days. Right? If you go home and that feels right for you, again, as long as we're getting some fluids, minerals inside, and some good foods, like high proteins, good carbs, good fats, helping to try to fuel this system, because it is in a crisis that needs a lot of nutrients right now. Those are some of the best things. Within the next day or two, try to get like light activities in, small movements, touching your toes, some back bends, some stretches on the floor, maybe go for a walk, maybe try to read a couple pages of a book, all to tolerance and symptom levels. Don't try to push through symptoms, but like things start rising, or if whatever you have as a baseline symptom starts getting worse, maybe pause for the day, try again tomorrow. It's kind of part of this return to play protocol that we'll touch on kind of later on in a bit. But yeah, I would try to get back to activity in moderate amounts as soon as possible. But again, start slow. Start with walking, start with breathing, start with some stretching and some movements. Don't go try to run right away. Don't try to go lift right away. And when you do in the next few days, start slow and monitor symptoms as they go. Exercise intolerance is a big aspect of concussion recovery. Making sure good blood flow back up to the brain is activated and stimulated is the first lines of defense. Yeah.
Interesting. So that sounds much different than the traditional concussion protocol for right after it occurs.
Yeah, there have been a lot of updates in the past few years, and I believe 2022 was our most recent update in concussion literature coming out of Amsterdam. So we have a large concussion summit every handful of years. I think it's 3 or 4. But it happens, and all these top concussion people across the world get together, some usually European city, and they review all the literature that's happened over the past few years and maintain the most accurate and up-to-date processes. This is where we get our on-field assessments and our clinical evaluations, some of these diagnostic tests that are the most valuable in concussion land, because it is not, even though we do have some structural changes, there isn't really a structural test or an imaging source that really captures concussion. So you can't take an MRI, you can't take a CT scan and be able to image or diagnose a concussion from something like that. There are some diagnostics that we can run, things like eye movements, balance. We can look at heart rate variability and some of these autonomic measures. Bilateral blood pressure is a big thing that's super easy to do, and if you're even a handful of points off from side to side, that does indicate an autonomic dysfunction. So these clinical evaluations, and they also include things like QEEGs and some of these brain recordings of how the brain is communicating to itself. But there's really no diagnostic imaging, snapshots, if you will, that really show or that you can appreciate concussion on. Actually, I think Abbott is developing some sideline tests for blood markers in acute sport-related concussions.
What are you looking for?
I believe the top 2 markers they're looking for is a GFAP protein, or GFAP, or glial. Let me see this here. Yeah, so it's a glial fibrillary acidic protein, and also an S100 calcium binding protein B. So these things seem to be elevated within the blood from about 6 hours to sometimes at an unreliable rate reaching into 24 hours. So they're developing more of a sideline, like a finger prick kind of deal. You're able to throw that in a little machine and it shows the sideline staff or the coaches yes or no, essentially, if these proteins are present. And we're seeing a high correlation rate with these proteins being present in acute phases and these individuals failing some of the sideline tests. And these correlations do go hand in hand. And
Interesting.
yeah, maybe one day that'll be a more reliable test, or more widely used, let me say, because I guess right now it's still under testing, but it'd be cool to have it, like sideline peewee leagues to high school leagues and everything, and all the way to the pros, and in multiple sports even too, not just football. But yeah, so there are some developing tests, and I guess blood labs are a spot image of your blood chemistry that are being developed, and maybe some levels of DTIs and these diffuse tensor image MRIs, these highly specialized images that take pictures of essentially axons and how fast hydrogen atoms move along them. You're able to see functional abnormalities within the white matter chains and these information highways within the brain. Some of that stuff, but again, it's a little inconclusive, and they're highly expensive tests, especially when compared to some clinical diagnostics and things like that show more efficiency rating and more accurate data to predict or diagnose concussion.
Yeah. Interesting. If you can see markers in the blood, then that means it's affecting other areas of the body, and it's more of a systemic issue than we once thought. If you can see markers, so tell us a little bit about like concussions as a systemic issue, what they're doing to other areas of the body, what other like side effects can be other than just, oh, you hit your head, you have a headache, dizziness, nausea.
Yeah, so outside of the acute phases of concussions that for most individuals last a couple weeks, right? If you're having symptoms beyond a couple weeks of an acute concussion, this does constitute usually as a post-concussion syndrome, or a symptom constellation, if you will. And then we start having some of these alterations and systemic kind of systems and how these things all signal and work, because at the end of the day, your brain is the one that signals the rest of the body to do things, release hormones, gut change your, signal your gut microbiome, and control gut motility and digestion, how your heart beats, how much air you're breathing in, blood chemistry. All of these things are really ultimately controlled by the brain. And if that thing is bathing in an inflammatory bath and not getting the nutrients it needs, and in this metabolic crisis, it's not going to be able to maintain some of these other systems of the body that it is in control of. So there are 5 subtypes of concussions, and some literature states up to 7, and everybody calls them different things. 5 subtypes that we have and that we have seen in our clinic and across our experience so far is a cognitive or a psychological aspect. This is your brain fog. This is the anxiety or the mood changes or the anger and irritability that come after concussions or bumps to the head. We have cervicogenic or neck involvement. So this is your whiplash. If you have sustained a concussion, if you've had enough force to cause that, you've had enough force to sustain a whiplash. I believe it's 20 pounds of pressure per square inch of force to create a concussion. I believe it's only 5 to create a whiplash injury. Concussions usually heal in 2 weeks. Whiplash takes about 12 months sometimes, especially if it's a PCS case and this individual is experiencing headaches or dizziness or even blurry vision. Check the neck out, because sometimes proprioception can be off, and how this neck is feeling, especially neck pain, can add into headache pains and things like that. So checking out the neck is huge. As chiropractors, we're positioned well for that as well. Third one is a vestibular oculomotor system, or how your vestibular system and your eyes and your neck all work together to create this sense of spatial awareness and balance. A lot of the times this is dizziness. This can lead to headaches too if there's an inefficient system. This can lead into fatigue. This can lead into also irritability and some things like that. ADHD symptoms, lack of concentration, trouble reading, light sensitivities, things like that. We also have, as our 4th subtype of concussion, an inflammatory, metabolic, or hormonal injury. And this is usually continuation of that neurometabolic cascade that has happened. Some things alter and change, where glutamate, which was once extremely elevated, is now extremely depressed. So stabilizing that and making sure that we're on the right track with that. Again, left untreated, this is where we see other alterations in things like the HPA axis, how your hypothalamus signals your pituitary and also your adrenals, how your autonomics then signal sex hormones, and how you regulate insulin through pancreatic control. All of these things start getting disrupted long term. And then the fifth subtype of concussion is autonomic dysregulation and blood flow related. This blood flow leads to exercise intolerance, lightheadedness, maybe even POTS-like symptoms, which can also have further dysregulation into gut issues and things like that. Those are the 5 subtypes. We have a cognitive, psychological. We have a cervicogenic or neck involvement, whiplash. We have a vestibular oculomotor system and how the brain correlates and processes information from the eyes and eye movements and vestibular system and your neck. We also have a metabolic, inflammatory, and hormonal. And we also have a autonomic and a blood flow exercise intolerance category. So you can have all 5 flavors, subtypes. You can have just one. We've seen it doesn't really determine the prognosis of healing. We've had individuals with one subtype take longer than individuals that have had all 5 subtypes, and vice versa. So we haven't really seen that's a predictor of outcomes. Actually, some of the biggest determinants are outcomes. If you are dizzy after a concussion, that is one thing that we have seen that does show a longer healing time than if you don't have dizziness.
So what are the studies regarding females to males in regards to recovery time? Is there any difference or comparison there?
That's actually a great topic. The number one biggest risk factor of taking longer to heal from concussions is being female. I believe it's really related to hormones and a potential pre-existing dysregulation, metabolics and inflammation and hormones that kind of sets the stage for further dysregulation. Sure. Most of these females are athletes. There's a strong correlation or a strong portion of female athletes that do undergo what's called the female triad and have issues with their periods and with their cycles and training and nutrients and things like that and how they all work together.
Well, with that, would you assume that birth control is probably also a large dysregulator predisposed for this as well?
Yeah.
Because typically young athletes that are having issues with those things are put on birth control to fix it. So that would make me think that's going to be a strong pro-inflammatory hormone disruptor that's going to set the stage for that to be pushed further into dysregulation.
Yeah, I think that there's a big issue with that. Not necessarily to blame the birth control itself, but maybe the quickness of prescription instead of addressing things like output load and nutrients and other ways to help balance hormones. That's the quick fix and answer. Sure. And that's the quick fix at age 13 for even some patients and some females. And we even see that now in like TRT with males in their 30s. Yep. If you don't address training and nutrients and stress and sleep, I'm going to address those before anything else, and especially just hopping on TRT, especially if you're a male in your 30s. But this change in the brain, and if left unchecked, leads to other issues. And HPA axis dysregulation and the gut-brain axis dysregulation go hand in hand. So your brain and your gut, to start, are the same tissue. They are connected, right? So if people talk about this gut-brain axis, it's really just the one system, in my honest opinion. But your blood-brain barrier and your gut barrier are the same cells, embryologically, and they create the same tissues. So when you have an injury to one, you usually have an injury to the other, and that's bidirectional. So this gut-brain axis is bidirectional. It communicates both ways. It's not just one-way street. We've seen that brain changes do show microbiome changes, and again, microbiome changes do show cognitive and mood stabilizing or mood stabilization changes as well. So this alteration back and forth is high volume, honestly. There's a lot of data points back and forth on a day-to-day basis.
Not to completely veer off topic, but what was the recent study with either dopamine or serotonin and how much they're finding the brain outputs versus the gut.
Your gut produces, I believe, 80% of your serotonin levels in your body. When that's not necessarily the same serotonin that your brain uses, but it does have effects into mood and things like that. Yeah, that does change as well. And when we have a change in the blood-brain barrier, we have a change in the gut-intestinal lining barrier, we have a decrease of absorption of nutrients as well. And that malabsorption then certainly doesn't help the increased demand of nutrients that the brain is undergoing right now. So then there's this vicious cycle, and it's where do we begin? You have to address your brain and your nervous system. At the same time, you address your gut and your other systems as well, because this is a ever-going cycle. Inputs into just one usually aren't enough to overpower the dysfunction that's continually feeding from the other areas. And this HPA axis does lead into a lot of other issues too. Water retention and that aldosterone, renin, angiotensin system is one of the it's how we modulate water. It's how we modulate the thickness of our blood. And then that's a lot of autonomic symptoms too. And in reality, it might not be necessarily autonomic and POTS related as much as it is just the physical consistency of the blood, because your brain is signaling either too much or too little removal of the water from it. That also signals changes in ACE. ACE is an angiotensin converting enzyme. I always just knew it as ACE. So ACE, or angiotensin converting enzyme, is also involved in this, and this does have regulations into blood pressure and heart rate. And usually individuals with hypertension are on an ACE inhibitor, or they're on a beta blocker or something along those lines. But this ACE is an enzyme, and it helps to alter that system as well, which an enzyme's created from protein. If you're having poor protein in gut digestion, you're going to have a poor even ability to create these enzymes too. Your brain also signals these neurotransmitters, communication devices that are quicker messengers than hormones are, and usually an alteration in those occurs as well, and a change of how we signal serotonin, and dopamine, and norepinephrine, glutamate, and GABA, and all these other things all alter as well, leading to a whole host of these psychological, cognitive, and otherwise seemingly unconnected systems are affected. And we have so many females, after my concussion, my period's never been the same. Or individuals with concussions years ago have had now toxin burdens now recently, and SIBO overgrowths, and all these otherwise seemingly unrelated symptoms, but they are all connected because your brain's been off for multiple years in signaling these things, and we got to be able to turn that thing back on while supporting the system that's dysfunctional at the same time.
You talked a little bit about autonomics and how that can get affected by a concussion. So what are a few details on that, and also maybe what are some things in that realm, since those are such a big area? What are some things people can be doing at home to help with that?
Yeah, fantastic. So autonomics basically control everything that's automatic in the body. We have everybody might know fight and flight, or the sympathetic aspect. This parasympathetic tone, or the rest and digest, is in between. And we have this polyvagal theory of a varying amount of stress is good or bad for the body, and we have these alteration zones, and some people really fluctuate in where they thrive the best, but usually a shift in that doesn't feel very good. And a change in autonomics can affect blood flow, it can affect temperature regulation, it can affect energy production and signaling throughout the body, it can affect how your brain and your body are connected, and a vast change of other things as well. If you look at a chart, we'll throw that up here too, you can see that there's tons of connections here that, again, seem otherwise unconnected, but they very much are. So addressing this, and usually the biggest input for this is exercise. This is all blood flow. And also temperature inputs or things like that. So exercise is some of the biggest thing. We want to increase blood flow. We want to increase cerebral blood flow and musculoskeletal blood flow. And how we do that is exercise. This can be walking. This can be slow movements. This can be aerobic exercise and cardio. And this could be resistance training. And again, a mixture of all of them is going to be the best bet at moving forward and seeing symptom relief. All to tolerance. And again, don't cause symptoms to spike and try to push through that. Once those symptoms spike, pause, take a note, and try to do that same thing again tomorrow and push it just a little bit more and a little bit more. You just want to push the envelope a little bit. You certainly don't want to go flying through it, and you're not going to do anything bad with that. It's just not going to feel good. It's going to suck, and you're really not doing anything more beneficial than just touching or kissing the envelope. Yeah, temperature's a big thing too, right? And if you've seen the big fads of migraine control over pop medicine and Instagram and TikTok and all these things, of putting your feet in hot water or putting like a hot rag on your neck or something, these are all autonomic changes in a blood flow diversion that can help symptom mitigation and management, but exercise is really where you get the healing to happen, especially for autonomics. Yeah, but it'd be like, so now we know a little bit about concussions. Who do we go see if you had one, if somebody's had one? Who should they look for? Who should they try to seek help from? They've tried to go to exercise and they've addressed their nutrition and tried sleeping better and they're not feeling good. Who should they go see?
All right, so let's say someone has a concussion a month or so ago, still having symptoms. They've tried everything they can at home to help themselves, nutrition and exercising. They're doing breath work, they're working on their autonomics. They're, in theory, checking all these boxes for these things, but stuff still isn't quite changing. Who do they go see? What do they look for? What kind of diagnostics, testing are they looking for? What are next steps, I guess, just in general?
You look for a concussion specialist and somebody who does specialize in concussion. There's a whole host of chiropractors and PTs in this realm, and even naturopaths that are very well trained in concussion care. I'm going to be biased and say look for a functional neurologist, or look for somebody who's gone through a functional neurology course, whether that's the American Board Academy or the International Board Academy, both of which have fantastic doctors that do great work and can certainly help you. There's a complete concussion care or a complete concussion management network. You can look them up and find their list of providers as well. There's tons of people out there, and the biggest thing is that you don't need just one therapy. If they're a vestibular specialist, that's great, but that's maybe not what you need, right? You need a full concussion specialist and somebody who's going to address not just your neurology, but also your metabolics and your gut health and all these other systems, and possibly check for hormones and run some clear diagnostics that are evidence-based and manageable and measurable to see change and to identify key regions for improvement. Some of these diagnostics are, like I said, ocular motors and pupillometrics, so how well your eyes move and how accurate they are, how quick they move. All these things have large implications into determining if you've had a concussion and if, what's at play here, and then potential therapies. Pupillometrics, or how fast your pupils change, a great metric for autonomics. Exercise intolerance, something like a Buffalo treadmill test. For having issues with balance or proprioception, something like a Computerized Assessment of Posturography, or CAPS, or an MTCIBS, and a modified test for the sensory integration of balance, or B-Trax is the company that runs that. Look for things that check for neck proprioception, like butterfly tests and joint position error screens, vestibular measurements, or vestibular assessments. In a clinical exam, we're looking for a VOMs test, and we're looking for a BESS test, essentially are the biggest things. And then I added bilateral blood pressure and a few other metrics. BESS, so BESS, or a balance error scoring system. This is where we check various positions of balance, so feet together, standing, also in tandem stance, so one foot in front of the other, and then in single leg on your weak leg. And we do that both eyes open and eyes closed, both on a firm surface and on a foam surface. And this gives us a really good breakdown and scoring system. This is a clinical test. It should be included in all concussion evaluations. And then vestibular OculoMotor, and we're checking for smooth pursuits, convergence efficiencies, optokinetics and visual motion screenings and all these other eye tests that if they do spike symptoms, probably a good likelihood that's going on at hand as well.
Interesting.
Yep. We also, in our clinic, we do QEEGs or brain maps. There's some evidence in this. Again, we're just looking for brain connectivity changes. We're not using this to necessarily diagnose concussions because we have a whole host of other clinical exams and diagnostics that are backed in helping determine concussion. We use QEEGs to see the functionality of how your brain communicates with itself and changes over time. Usually we do see quite a bit of changes with these. Hopefully sometime in the future being able to publish studies with some of these correlations and changes would be really cool. But
yeah. And based off of that stuff,
we'll also check for some blood labs or some specialized testings to see some of these further things down the line. If it's basic blood labs, hormone changes, cortisol levels, organic acids tests, stool tests, to check GI with the stool, or check neurometabolites and other toxin levels with an organic acids test, and check Krebs cycle and how your cells are producing energy, or basic blood labs to check other symptoms and markers and things and ways that we could address some of these symptoms, especially if it's been long term.
Yeah.
All those labs are definitely part of the battery of intake and comprehensive measures that we take to look into these things. Yeah.
Then let's talk a little bit about some of the therapy options, some of the different modalities, treatments, all of those things that people can be doing to actually get improvement once they aren't seeing these changes from just changing stuff at home.
So, first thing, I guess everybody likes to get healed super fast, right? There is a time length with this, and we've seen that the faster you do see a specialist, usually the quicker your recovery time is. So if time is of the essence for you, get to see a specialist sooner. Within 48 hours, 72 hours seems to be some of the best time frames to get in for a specialist and decrease your odds for long-term symptoms. But again, addressing the Axon Big Five, so nutrition intake, looking at sleep and sleep quality, getting good breath work in, getting good exercise in, and having a good positive social community to spend time in. If you have those 5 things, that's the base of the triangle.
I would add one other one as well, and that would be stress levels.
Sure.
That's not one of the big 5, but I would argue that's a very important one for concussions as well, is to try to mitigate stress levels as well, because that's just going to keep your pro-inflammatory cascade going.
Yep.
If as soon as it happens, you're just ramped up for the next however many days, weeks, whatever.
And stressed you're missing work and having to go run around to these doctor's appointments and all these things, and just be on a healing journey and give yourself some grace and gratitude to be able to heal and get yourself right, because if you don't right now, it's going to take you longer later on, and you running at 100% is way more valuable than you running sub 100%. Practice a good return to play protocol. So we have one that if you go to our website, you can download in the resources section under return to play. We have a resources tab, and you click that and you'll be able to find a whole laundry list of PDFs. The return to play protocol is on there, so you can go ahead and click that. It's a 7-step protocol that we've developed and compiled from various resources and educational articles around these things. And we've created these 7 steps that progressively get harder and harder. If you have an increase of symptoms, then you pause and you repeat that step the next day. Or one of the first things that you should probably ask a concussion specialist is if they have a return to play protocol and what that is. If they don't, I'd probably call the next place. But that should be something that they deliver to you right away and included, because more education, more knowledge to you is a better chance of recovery. There's a handful of basic supplements out there. Some of the biggest stuff that helps with concussion that's researched and shows good benefits are omega-3s and creatine. Those are some of the heaviest studied supplements. I would also throw in magnesium, again for that calcium-magnesium balance going on. I would also probably throw in some B vitamins. For magnesium, particularly magnesium L3, it's the only one that gets into the blood-brain barrier and can have a positive effect in the central nervous system, helps improve sleep, helps anxiety and stress, helps brain inflammation, helps all kinds of things. That coupled with omega-3s and getting good fatty acids up into the brain, coupled with creatine for good cellular energy through that phosphocreatine system and delivering energy directly into the cell, in high doses. Some articles suggest up to 15 or 20 grams of creatine per day to be able to have a positive effect into the central nervous system. Those are some of the best things. Some of the higher level therapies, and looking at some of the neuro rehab stuff and eye movements, motor integration, breathwork techniques, things like acupuncture, chiropractic care, dry needling, and laser for the neck, and if whiplash is present, are all positives. They're all really great. I would look at those before you start looking at solely things like hyperbaric or red light or IV therapies. These things are great additionals to help support some of the active rehab that you are doing, but those things, and they do show good literature and good support. However, we've just found that in combination with other active modalities, we have some of the best outcomes.
Yeah, I would agree.
Yeah, I guess we can share a little bit about our recent concussion injuries and stories for ourselves. I'm not sure, I guess you had one from way back as a little kid.
Teenager.
And we put this even on our intakes. I think this was even before your teenage years, but on the intakes it has, even that time you were a kid and you fell off the swing and hit your head on a tree, which is actually her.
Yeah.
And it's funny just because we use that as an example.
Knowing now what we do, that definitely caused some metabolic, hormonal, all of those issues, because it was in the middle of puberty, fell from a substantial height in a tree swing, not just a normal swing, from a substantial height. Definitely did not do any kind of return to play, anything like that. Just went back to business as usual and ignored what was going on, because back then nobody really knew as far as concussion stuff. In hindsight, not the best way to approach it, and definitely had some long-term issues that we've since been working on. But
yeah,
definitely one of those things that you don't really think about it until you think about it. Yeah.
Or some questions are asked. But you can sustain a concussion all kinds of ways, and just being more knowledgeable about some of the signs and symptoms and who to get help from, what to look for in therapies, what to be doing for yourself are all huge things. If you've sustained a concussion or you have friends or family or anything like that, have them reach out to a concussion specialist. They can give us a call and we can help point them in the right directions. But try to incorporate some of these things into your life and let us know how these go. If you have any other tips, pointers on concussions too, we'd love to hear them. I'm sure the audience would love to hear them. Throw them down in the comments if we missed anything. I'm sure we did. I'm sure there's a whole laundry list of things to be touching on. But this is how we address concussions in our clinic and have great success.
Yeah. Thanks for listening to the third episode of Brain, Body, Mind podcast. We appreciate you being here, tuning in and listening to what we have to say. If you have any ideas for topics, anything you want us to talk about in the next one, any questions based on what we talked about today, please feel free to let us know. Otherwise, hopefully, we'll have you listen to the next one.